Welcome to your video tour of the muscular system. Today we're going to walk through the major muscles of the body, where they're located, what they do for you on a daily basis, how you might use them in your day-to-day life, and then as we go along you'll label them on your diagram. At the very end there will be some quizzes that you will fill out with your handout, and then you'll turn them in for a grade. That's how you'll be graded on your video tour of the muscular system today. So let's get started. We're going to start first with the head and the neck. So the head and the neck have lots of interesting muscles to them. Just to kind of give you just a sense of muscles, I want you to just kind of look as the head spins around here. The different shapes. Some muscles are big and fibrous, some are long and sinewy, some are broad and fibrous. So really muscles can be lots of different shapes and sizes, and based on their shape and size that allows them to do specific functions. So keep that in mind as we go along, because it'll help you to kind of remember what each muscle does if you kind of can remember what it looks like. Alright, so let's start off with the first muscle of the head, and that is the orbicularis oculi. And this muscle is a circular muscle that is around the eye. And this muscle's action is to close the eye. It kind of puckers and gives you the crow's feet at the corner of your eye when it closes. And as it closes, it also squeezes the lacrimal gland, which is your tear duct gland, and that's really important because you need to keep your eyes moist as you are going about your daily job life, so that you can keep dust particles out of your eyes and bacteria out of your eyes. And people can develop real issues if their lacrimal gland isn't producing enough tears, and they might have to get fake tears. The name orbicularis oculi comes from Latin, and orb means circular, so that kind of gives you the idea of the shape of the muscle, and oculi means eye, so circular eye or disc eye. And I wanted to show you this interesting video I found. This is a French gentleman who claims that he developed a way to make his vision three-dimensional when he looked at television screen without using the 3D goggles. So on the sides of his face he has attached little stimulators. They're sending out little electrical impulses that cause his orbicularis oculi muscle to contract, and when that does, his eye closes. But I just wanted to show it to you because it shows you how fast and how precise your orbicularis oculi muscle can be. So right now he's calibrating, and you can kind of see it working. And then he's actually hitting the program there, and here it begins. And his eyes get to blinking so quickly that you can sometimes hardly even tell he's blinking, it's going so fast. So really that muscle here is working overtime. Very interesting. It has been proven by science that he's not really seeing in 3D, but I thought it was a good case in point of the muscle being used. Okay, up next is the orbicularis oris, and right off the bat you should be able to see that this muscle, because it has that orb in it, is also going to be circular. And this muscle is another sphincter muscle. That's what we call muscles that are circular, that is around the mouth. And this muscle helps you to pucker your lips and to close your lips. It's sometimes called the kissing muscle. It helps you to play your woodwind brass instruments. And I found a pretty funny little video here that shows a good example of the orbicularis oris muscle in use. So here we go.
This is the venue they chose for their fake auditions for an advert for lip balm.
We're hoping that we can use part of this in a national commercial, right? And this is a test on some lip balms that we have over here. These are our models who are going to help us, Roger and Matt. Okay. And we have our own lip balm, and we have a leading brand. Would you have any problem kissing our models today? you to go ahead and put a blindfold on. Okay, now can you see anything? No. Hold up so you can't even see down. Okay. It's completely blind now, right? Yes. Okay. Now what I'm going to be looking for in this test is the texture, right? And maybe if you can discern any flavor or not. Okay. Have you ever done a kissing test before? Yes. I'm going to ask you to pucker up big and lean in just a little bit, okay? All right. How did that feel?
So maybe a way that you can remember the name of this muscle is to think orangutan, Horus. Okay, next up we have the masseter. And the masseter muscle is a big, thick band of muscle that runs down your cheek from underneath your zygomatic arch bone to the edge of your chin. And it is what allows you to close your jaw and to chew. It comes from the word masticate, so masseter, masticate. So it helps you to chew, and it can get pretty tight and agitated for people that grind their teeth at night or people that clench their jaw while they're sleeping. And the masseter muscle is also involved with TMJ, and we talked about TMJ. TMJ stands for transmandibular joint dysfunction. And it is the joint here. And when your jaw is misaligned and you are kind of closing your jaw out of alignment, that joint can become really agitated. Sometimes surgery is needed or strengthening muscles to work on balancing the two sides of the muscle. But that is the masseter and the TMJ. And it is the strongest muscle in your body relative to its size. Because it is so thick and so fibrous, it really it produces a lot of force. So you can imagine that in herbivores, animals that really have to masticate a lot to chew their cud to get through all those cellulose and plant fibers, they would have really, really, really thick masseter muscles. All right, here is a little video that talks about the masseter muscle.
The masseter is the strongest muscle in the body relative to its size. It is composed of two overlapping bellies. The superficial belly can be accessed from the face. The deeper belly is palpable from inside the mouth. The masseter is situated deep to the parotid gland, yet is easily palpable.
So the masseter, strong enough to bite off a human finger. But we're not going to do that today. Instead, we're just going to chew a little bit of gum. I gave my partner a big old piece of Hubba Bubba, and there you can really see the masseter on the side of the mandible really engaged. And go ahead and just clench for a moment. And there you can even see some of the muscle fibers running this way vertically up to the zygomatic arch. Great, go ahead and keep chewing. There, just behind the eyebrow, we can see some of the temporalis as it sort of dimples the side of the head there. And what's really interesting is that you've got two masseters and two temporalis muscles contracting constantly all day long and putting terrific strain right here on that small little temporomandibular joint right there, 4,000 to 6,000 times a day. Well, let's lay our partners of mine and we'll palpate from there.
Okay, moving right along. The next muscle we have is further down. We're leaving our face now in the neck, and it's the sternocleidomastoid. Quite a mouthful. But these are two muscular bands that run down either side of your neck, from behind your ear to your collarbone. And they help you to flex and rotate your head and bring your head closer to your chest when they're working together. So daily use for the sternocleidomastoid would be to look over your shoulder or to look down at your toes. And it is kind of interesting that a lot of designers, a lot of movie makers, when they're designing sets and characters, if they want an alien life form to seem more humanoid, will give that alien life form, like C-3PO here from Star Wars, those sternocleidomastoids on the side, so that they seem more familiar, seem more human-like. Okay, next we're going to move on to the muscles of the trunk. And we're going to start with the deltoid muscle. And the deltoid muscle is your shoulder, and it acts to extend and flex your humerus. So extend means to increase the angle between two bones, and to flex means to decrease the angle. So you can think about flexing your bicep. You're bringing your lower forearm up towards your humerus. So it helps to do both here. A daily use for the deltoid would be lifting. And the deltoid gets its name from the Greek letter delta, and delta is written in Greek as a triangle. So it's written like this. Because the deltoid muscle is very triangular, this body is turned a little bit to the side so you can't see it, but I'll point it out in another photo coming up. So it gets its name for its triangular shape, and it is particularly enlarged in some of our cousins here, in our apes. Because they walk on their knuckles, and they have to do a lot of extending and flexing the humerus to walk on their knuckles, so they have particularly large deltoids. All right, next up we have the pectoralis major, or the pecs in common terms. And the pec muscles are fan-shaped, and they extend from your sternum to your armpit. So kind of here is one, and the other side is over here. And they help to flex your humerus, they help to adduct your humerus, to rotate your humerus inside, and they also help with really deep inhalations when you're exercising. So a daily use of the pectoralis major would be for you applying deodorant, because anything that's bringing your arms across your chest is going to be your pecs. They are pretty fibrous muscles, and because they are really used in sports, they're a common sports injury to get pec muscle tears or strains. There is a disorder associated with the pectoral muscles that's called Poland syndrome, and that is where one side of the pecs doesn't develop. So if you look at this gentleman down here, this side of his chest, he has a normal pec muscle, and on this side of his chest it looks a little sunken, and that's because underneath of that particular side of his chest he doesn't have a pec muscle. So that is Poland syndrome. Okay, moving further down, next we have the external obliques, and these are your stomach muscles that run down the sides of your stomach. And they help you to rotate and twist your vertebral column. They help you to pull your chest downward, and they also help to compress your abdomen. So a daily use for your obliques might be raking leaves, because you're kind of constantly moving to the sides as you rake your leaves. And another great example of the obliques is the human flagpole. So I found a good video to show you some heavy oblique action here. So this is part of the Guinness World Records, and this gentleman is trying to win for his human flagpole. So this is where you have to put your body perpendicular to the flagpole and hold it for as long as possible. So there you go. There you can see it. That is some major oblique action to be able to hold your vertebral column straight there and not have it twist with gravity. He's really working hard, and you can see him start to shake as he's holding it, because he's starting to develop that lactic acid. He's starting to get some muscle fatigue. And not only is the obliques working, there's a lot of muscles working here, but this is a good example of some really good core muscles here, because your obliques are definitely some core muscles. 33 seconds, 34, 35. The world record was 31, so he clearly broke it there at 39 seconds. Moving along, next we have the rectus abdominis, and these are the muscles that run down your middle of your core, and we know them as the six-pack for those of us that have very highly developed muscles. And they help to rotate and flex your spine. They also help to increase your intra-abdominal pressure, So these are used when you are vomiting or during childbirth, and down through down through the middle of the six-pack, you kind of have this white line. This is and extends from your xiphoid process of your sternum all the way down to your pubis. This is what's called the linea alba line, and it's just some connective tissue that runs down through the middle of that six-pack. Daily use for the rectus abdominis would be moving from lying to sitting. If you're not using your arms, that would be the rectus abdominis muscles. They get their six-pack appearance from connective tissue bands, big fibrous bands that transverse the muscles, and that makes them look like they're kind of segmented into that six-pack appearance. All right, moving along to the back, another really large muscle that is kind of diamond-shaped is the trapezius, and the trapezius is what's going to be moving your scapula and supporting your arm. So daily use of the trapezius would be shrugging your shoulders or doing anything over top of your head. That's going to be your trapezius muscle. This gentleman, for example, has a very, very defined trapezius muscle. So you can see it here. It almost looks like a four-leaf clover or a clover. It's named for its shape because it resembles a trapezoid if you look at it closely. All right, on the back, further down, kind of underneath the trapezius, is your lats, your latissimus dorsi muscles. And remember, dorsi means back, so that gets its name from back. It is the broadest muscle of your back, and that's literally what it means. It helps you to rotate your arm at your shoulder, and it helps to forcefully depress your scapula. So when you're pulling your shoulder blades really far down, that's going to be your latissimus dorsi. So daily use of your lat muscles would be pushing on the arms of the chair as you're standing up. That would be a good use of your lats. This muscle is so big and so broad that really it's very hardly ever injured. It's just one of the powerhouse muscles of sports, but because it's so big, it really doesn't see a lot of the sports injuries that some other muscles do. There is a very interesting surgical procedure that is done with the lats. For a lot of people that have hearts that are not pumping out as much blood as they should be, they can cut the lat muscles, and when they cut them, they can wrap them. They make an incision, and then they wrap part of the muscle around the heart. And then they put a pacemaker into the person that sends electrical pulses. And when the pacemaker sends a pulse and a muscle receives it, the muscle contracts. So really, the pacemaker controls the back muscle. And when the back muscle is wrapped around the heart and it pulses, it pushes blood and it makes the heart stronger. So just an interesting use for the lat muscle. And that's called cardiomyoplasty. So people that aren't good candidates for a heart transplant, they might try that. All right. And there's a picture of it. So you have the pacemaker, which is down here, and then you have the lat muscles wrapped around the heart right there. Okay, next up, further down we have your glutes, your gluteus maximus. And the glutes are the largest muscle of the body. They are helpful for extending and rotating the hip, keeping your trunk erect, and supporting your extended knee. They are daily use, used for running and for the extension phase of your leg as you're walking upstairs. And they have a very interesting evolutionary significance. If we look at differences in physiology and anatomy between chimpanzees, our closest evolutionary descendant, and us, we have a lot, but we have them specifically in our muscles. Couple examples. We have a much larger glute muscle than chimps. We also have a much larger calf muscle than chimps. We also have much more arch in our feet than chimps. And our muscles here in our trapezius and our sternocleidomastoid, we have many less connections than chimps. And that's because we can rotate our head as we are walking and running, and chimps really can't. What this tells us is that humans may have been born to run. In other words, humans may have been born to be marathon, long distance, 50 miles a day runners. Because of these adaptations, the glute muscle is really used in running. Your calf muscles are really used in running. They help you to spring, and those arches help you to absorb shock. So it's thought that maybe when we were caveman-ish times, instead of hunting animals, we ran after animals and we ran them down. We ran them until they were too tired to run anymore and they collapsed, and then we killed them and ate them. So just kind of an interesting evolutionary history of your gluteus maximus. All right, up next you have your gluteus medius, and it is partially under your gluteus maximus, so it lies underneath, so you can't necessarily see it if you're just looking at the side of the muscles. And it is also to rotate your hip internally and externally. Daily use would be to step sideways out of the bathtub. You would be using your gluteus medius. And underneath that, you have your gluteus minimus, and it also helps to rotate your hip. It's fan-shaped, and it's the smallest of the three glute muscles. Daily use for the gluteus minimus would be getting out of a car. Both the minimus and the medius gluteal muscles help you to keep your pelvis in a good position. And if one of those muscles becomes paralyzed because of a car wreck or some kind of sports injury, you can develop what's called the gluteal gait, and it's where you kind of have to drag one of your legs kind of to the side and kind of shuffle, because again, these help you to rotate your hip. All right, leaving the trunk and moving to the arm, let's start with your biceps. So the biceps brachii. So biceps, that beginning prefix there, bi, means two. And the reason we have two is because the biceps has two heads. And so here, if we were to take away the deltoid, the triangle muscle here, we would see two heads to our muscle attaching underneath. Good use of or good example of the biceps would be picking up your book bag, because it flexes your elbow. In other words, it decreases the angle of these two bones. There we go, somebody flexing. So again, muscle with two heads. There's a better picture. So we have one head here and another head there. And this is a very common muscle to injure in terms of its tendon. So you can injure this tendon, and that would be where we have tennis elbow. Or you can also injure the tendon that attaches to the upper part of the humerus. All right, next up we have the triceps brachii, and this helps to, or acts to, extend the elbow, straighten the arm, and then the long head of the triceps pulls on the humerus. The reason the triceps have their name is that the triceps have three heads instead of two, and it is your only muscle found on the back of your arm. So it's the only thing back there. A good example of a daily use for the triceps would be pushing a door closed behind you. So again, muscle with three heads. It makes up 2/3 of the mass of the arm, so it's one of the largest muscles in your arm. And again, it's the only thing on the back of the arm. Evolutionarily, it's interesting because many other mammals, dogs, cows, pigs, instead of having 3 heads on the muscle that runs behind their arm, they have 4. Which is probably a factor of them walking on 4 legs and us walking on 2. All right, next muscle is the brachioradialis, and it flexes the elbow as well. So there you see it running down the arm. And daily use of the brachioradialis, because not only does it flex the elbow, but it also allows you to kind of twist, is manually sharpening your pencil, where you're actually having to twist the pencil in a manual pencil sharpener. Next up, we have the brachialis, and the brachialis also flexes the elbow. It would work with the biceps brachii and you picking up your book bag, flexing your arm. And I have another little video here that talks about the brachialis.
Brachialis is a strong elbow flexor that lies deep to the biceps brachii on the anterior arm. Portions of brachialis are accessible, with its lateral edge being superficial and palpable.
The next time you're on a flight, I encourage you to just lean over to the person next to you and just begin palpating and exploring for the brachialis muscle. It doesn't matter if you know it or not. Just give it a try. guess in order to do that, we should probably show you how, first of all. So I'm going to shake hands with my partner. And the brachialis can be a little bit elusive because it sits underneath the biceps brachii muscle. And what I'm going to do is just outline an edge right here along the lateral side of the arm from the deltoid tuberosity to the inner elbow. And if I ask my partner just to go ahead and try to flex your elbow a little bit, great. Here we can see the biceps brachii belt right there. Deep to that is going to be the brachialis, and right along that edge here is going to be the edge of the brachialis. So,
all right, hopefully that helps you to visualize it on your arm. Now, last segment that we have to go through is the leg. So let's start with one of the major muscles of your quadricep. And the quadriceps are the muscle group on the front of your leg. The hamstrings are the muscle group behind, on the back, the posterior of your leg. So the rectus femoris is the muscle that kind of runs down the middle part of your muscles of your front of your leg and attaches to the kneecap. It helps you to flex your hip, and it also helps you to extend your knee. A good daily use of the rectus femoris would be you kicking a soccer ball. And interestingly, if you have a compression injury in the rectus femoris muscle where it's compressed against a bone, you can actually have bone tissue start growing into the muscle and forming like a hard knot of bone inside the muscle that becomes almost like a ball, and you need surgery to remove it. That's called myositis ossificans. It's kind of an interesting disease. So the next muscle of your quadriceps is the vastus lateralis, and as its name implies, lateral means side, so it's the muscle that runs down the side of your leg. It is also part of your quadriceps, so it's the outer of the four muscles of your quads. Also attaches to the kneecap. It's the largest muscle of your quad. It helps you to extend your knee, and daily use of your vastus lateralis would be cycling or walking upstairs. Then you have your vastus medialis, and as its name implies, medial, it is towards the middle or midline. Okay, so it's going to be on the inside here. And it is the most inner muscle of the quadriceps that attach to the knee. It helps to extend your knee. Again, daily use, it's going to be very similar to the lateralis. It's cycling and walking upstairs. And then you have your gracilis. And the gracilis helps you to adduct your hip, to flex your knee, to internally rotate the hip when your knee is flexed. And some daily uses of the gracilis would be sitting on the floor with your knees propped and then keeping your knees together. Then we have the sartorius, a very long belt-like muscle that runs from your hip down past your knee. And it helps you to flex your hip and knee. It also helps you to rotate your hip as it flexes and your knee as it flexes, and to abduct the hip. And some daily uses of the sartorius, and when you can really feel it, is when you're sitting cross-legged and you push your knees all the way down as far as you can towards the ground. You're really feeling your sartorius engage. Next up, we have the adductor longus, and it is for hip adduction and flexation. And a good use and a time you would be really engaging this muscle is bringing your second leg into the car. So picking it up off the pavement and swinging it in. You're moving your hip like you would for the adductor longus. It's a common muscle that gets pulled when you have groin pain or a groin muscle pull. Because if we're looking at this picture, this is the coccyx muscle, your tailbone. This is your pelvis. So this is the muscle that really runs down the inside of your thigh. All right, moving further down to our lower leg. First up, we have the gastrocnemius, one of my favorite names for a muscle ever. And it helps you to flex your foot and your knee. Daily use for the gastrocnemius would be you standing on your tippy toes. It's a very interesting muscle because it crosses both your knee and your ankle, so it's pretty long. It helps you to flex both of them, but because it's pretty large and because it goes past two joints, it's pretty prone to cramps. You can get pretty bad Charlie horses in your gastrocnemius. Also, I want to point out here, this gastrocnemius ends in the calcaneal tendon, which is also known as the Achilles tendon. And this tendon is very commonly torn in runners because, as you can imagine, when you're moving your foot like this, it's only attached right there and it's very easily pulled, which is a very painful sports injury. Next up, behind the gastrocnemius, is the soleus. It is with the gastrocnemius what we call your calf and your calf muscles. It helps you also to flex your foot. Daily use is when you're standing upright. For you to balance, you're using your soleus. All right. Next up, we have the extensor digitorum longus, and it helps you to extend your toes, and it helps you to flex your toes. And as it runs down the leg, it's divided into 4 parts, and I don't know why my movie is covering it up, so let me just for a second move this so that you can see it, and then I'll move it back. So as you can see, this muscle comes down and then it becomes the tendon that reaches down into your lateral 4 toes, which means it really helps you with flexing of those toes and making those toes very dexterous. So I just wanted to show you an example of the dexterity of your toes with this video. This is a gentleman who has lost both of his arms, and he is going to entertain you by playing you some Red Hot Chili Peppers. So for daily use, you can put playing guitar with your toes, or you could put walking upstairs and making sure your toes clear the edge of the step. All right, to the front of the foot and the leg, we have the tibialis anterior. Tibialis because this muscle attaches to your tibia bone that would run behind it. And it is for inversion and dorsiflexion, or flexion of your foot, dorsal for foot. It helps you to walk, to clear your foot off the ground and not drag your toes. And then I just wanted to talk, because everybody always asks every year about a couple different things when we talk about muscles. First off is people tend to ask, what is the rotator cuff? And that's a good question. So the rotator cuff is a collection of 4 muscles that and tendons that work to stabilize your shoulder. And the muscles are the supraspinatus, infraspinatus, teres minor, and subscapularis. And because those muscles all have to work very well together, and they all attach to your humerus and your scapula, they're very easily torn, or you can have very easily torn tendons because of trauma to your shoulder or just normal wear and tear. People that are using their shoulders a lot, like tennis players when they're doing their serves, it's just an overuse injury because they're constantly doing the same motion with those 4 muscles and their tendons. Another commonly asked question is, what is the ACL? And the ACL is another connective tissue component. It's the anterior cruciate ligament, and it runs around your knee, and it helps to keep your knee from sliding forwards and backwards on your tibia. And so ACL tears are pretty common in sports as well because you put a lot of pressure and force on your knee. These ligaments are there to help your knee be stable, but they can only take so much force and pressure. And so a lot of times with a slide tackle in soccer or a tackle in football, you can pretty easily tear your ACL. All right, so we've come to the end of the presentation, and now you're going to need to look at your notes, and you're going to need to take the quiz. So you're going to be looking at these terms below. below for each of the pictures, and then you're going to be moving them up to the appropriate box. And you definitely want to check your answers to make sure that you get 100, so you might want to grab a book too. All right, happy labeling.